If you're getting a collagen that doesn't have a lot of type 1 and type 3 in there, you know that's not going to be great for your skin. If it has a lot of type 5 in there, that might be great for your joints, but not necessarily going to be great for your skin. And also, you need a lot of type 5 for your gut linings.
You're listening to the Integrative Medica podcast with Dr. Jake, a licensed naturopathic doctor who will show you how to tap into your body's natural ability to heal your health issue and improve your symptoms quickly without harmful drugs or devastating surgeries. So pour some tea, get comfortable where you are, and enjoy this healing episode.
Hi, everyone. Welcome back. I'm Teresa. I am a mom. I am a wife to a cancer survivor and a health nut myself. And today I am with Dr. Jake of Integrative Medica to talk about collagen to improve aging. Dr. Jake.
Collagen is a really fun topic because we need collagen for multiple aspects of our health, especially aging. We need it for our skin, our joints, and we need it for our gut health. So we're going to dive into that today.
Now, I know that you've had some success working with certain patients, specifically with collagen. Tell us a little bit about that.
So yeah, I had Linda come in. She was actually a mom of one of my employees, and she was really interested on decreasing wrinkles in her face. She started getting more wrinkles around her eyes and her nose and her lips, and she wasn't really liking that. And she wanted an alternative to just using Botox or other fillers or things like that, because she knew that it was caused by degeneration of the skin. So she came in and we dived into what we need to do. We talked about some dietary things. We talked about some supplements that she could do to improve her skin elasticity. But if you do have wrinkles right now, just doing dietary things and taking supplements aren't going to do the trick. That's more of a preventative type of thing. So what we did is we formulated a plan to help regenerate the collagen in our skin.
That's good. Great. Well, I can't wait to hear some of the details of what you did. I know that I'm 41 myself and am definitely seeing the consequences of aging. So I'm very eager to find out how I can improve that as well. So let me ask you this. It seems like you kind of alluded to it, but I want to be very clear to our listeners. With the integrative approach that you take on health and wellness, is your goal with collagen merely to put back into the body the collagen that it's not producing, or to get the body to be able to make it on its own?
So my goal is to do both. So I supply the body what it needs to be able to have the collagen it needs to help regenerate and heal. And I also give treatments to help stimulate regeneration of the collagen.
So that's what that regeneration is actually getting the body to produce that collagen.
Yeah,
fascinating.
Produce its own collagen. So we supply what it needs to do that, and then we give treatments to produce its own collagen.
Well, great. Well, we're going to be talking about that today, but I do want to make sure and clarify with our audience that this is just a podcast, right, Dr. Jake?
Yeah, this is just a podcast. So if you really want detailed answers, you should set up a virtual visit with me or someone on my team, and we could really dive into what we can do for you.
Right. So if you have been diagnosed with any particular health issues, just remember that this is not here to replace any of that. Make sure and see a doctor. So moving on, let's talk about this very popular topic of collagen. What is collagen exactly, and why is it so popular right now?
So there's multiple different types of collagen. I mean, we have types 1 through 5, which are the most popular ones we talk about, but there's tons of different collagen. I mean, we have collagen like keratin, which is found in our hair. So it's needed for multiple aspects of our health, mainly on the anti-aging realm, because our skin, our joints, our gut, our hair, it's all made of collagen. And as we age, our collagen starts to break down. So we start to get more wrinkly, our guts start to not work as well, we start to lose our hair, or our hair becomes more brittle, and that's because the collagen's degeneration. So if you're not getting good quality collagen in your diet or through a supplement, it's going to make the process much faster of the aging process.
So collagen is it like a protein, or what is it exactly?
Yeah, so collagen is just a protein. It's just a link of proteins in a certain way. So we have proteins throughout our body. We have several different amino acids, and collagen is just a link of proteins together.
Could one, instead of taking collagen, could one take certain amino acids and then their body would take those amino acids and make collagen? Or is that what happens with aging, is that you just stop doing that?
You do need good quality protein sources and good amount of amino acids to help heal and regenerate your collagen throughout your body. But also it's a good idea to take a good quality collagen supplement also, if you really want to be aggressive about it.
Okay, so let's talk then, I guess, a bit about, well, I mean, again, you kind of alluded that it's necessary for skin, it's necessary for hair, it's not for what happens. I mean, obviously, we know that you get wrinkles, right? And I think you even mentioned about, hair kind of. I don't know, does hair fall out? Does it thin? So we've got the skin part down. I think that's pretty common knowledge. But what happens to our hair? What happens to our joint? What happens to our gut as our body gets older and stops making this collagen that we need for our youth?
So our body is constantly under oxidative stress. So that's why we take antioxidants to try to decrease that. But the longer that we live, the more oxidative stress that happens and more trauma happens to our body. So, and one of the aspects of the trauma is our collagen. It starts to degenerate. So it will start degenerating in our hair and in our skin. So we become more flabby and our skin's not as elastic. Our hair starts to get more brittle. Our joints start to hurt and they don't have as much cushion as they used to. Our guts start to not absorb their nutrients as well. This is all from the degenerative process that happens with the collagen.
Interesting. So we were mentioning about, amino acids and how our bodies can use it. And you said that you can bring it up through diet. So what are some things that we can eat, I suppose, to help get some of those essential amino acids in the first place that might be contributing to our lack of producing collagen as we're getting older?
So a really great thing you could do, let's say just eating high amounts of collagen or whatever, is you would get it from animal proteins. So you get the collagen from there. So collagen surrounds bones. So any type of flesh that you're getting around bones, you're going to get a high amount of collagen from that source. So you can eat plant-based amino acids and that will help regenerate your collagen, but the best source really is from animal products because that's where we're going to get that direct source of collagen.
So like animal, like just meat in general, or
You
would
could
it
eat
be like bone
beef or
broth?
chicken or fish or pork. I'm not a huge fan of pork because it's very high fat and not a lot of nutrients in there, but you'll get collagen from all these sources. I mean, there are some great sources like bone broth can be a really great source to get collagen. I really love doing that. There also are some traditional dishes that we don't really do here in the United States, but I know in Brazil they make a dish in which it's a soup and they put in like a hoof of a cow and they put it in there and you're getting a really high amount of collagen through doing that.
It makes me think of my grandmother who used to put,
Oh,
like chicken feet in our in
yeah,
our
that has a
when we
good
were
amount of
growing up.
collagen in it too. Yep.
Yeah, and that explains it because she did have actually really good skin. So I
There you
wonder
go.
if she knew that was part of it. So, my heart's going out a little bit to people who, they're hearing about this plant-based diet, like plant-based is the way to go. We've got these blue zones that we're hearing about. For somebody who wants to stick primarily to a plant-based diet, but they do want to improve, their youthfulness and so forth. Obviously there might be a little bit of compromise that needs to be made when it comes to what you're saying here, right? Like
So
if
if we're going to focus just on collagen, yeah, you got to eat a lot of animal products if you want to get that collagen, but there are other ways to go about it. So if you're plant-based, you usually, I hope, are eating a ton of antioxidants. So you're going to, when you're doing that, you're not going to age as much. You're not going to have as much oxidative stress on your collagen. So it's not going to degenerate as well. So the more antioxidants you get in, the less degeneration that will happen there. You also could take stuff like glutathione, alpha-lipoic acid that can really help get that antioxidant effect also. And then you want to make sure you get a good amount of protein in. A lot of people doing plant-based don't get enough protein in. So if you're not, your collagen is going to degenerate even more. So if you're making sure that you're getting a good amount of antioxidants like through berries, fruits, vegetables, and then you're taking supplements, glutathione, alpha-lipoic acid, and getting enough protein, you're going to be in good shape. So you don't absolutely have to eat meat to really have youthful skin.
now, is there a type of percentage when it comes to how much protein one should be, whether it's from animal sources or plant sources? Like, is there a certain like macro percentage that is ideal for making sure that your body is getting the nutrients it needs to stay young?
So let's say you're just a typical guy or girl that doesn't exercise a lot or trying to build a lot of muscle. 0.8 milligrams per kilogram is plenty of protein for you. But if you're a big runner or you're a big weightlifter or you do a lot of sports, you want to get more in the 1 or 1.2 milligrams per kilogram.
That's a real fancy calculation, doctor. How might I be able to figure out that particular ratio that you just?
So let's say you do 2.2 times your pounds, and then times that by 0.8.
So I'm 120 pounds. Let's use me an example so I can help, because I'm needing your help, doctor. I'm 120 pounds.
120 pounds, and you divide that by 2.2,
Okay.
and then times that by 0.8, and that will give you the milligrams of protein you need per day.
Awesome. Thank you so much for that. I'm going to do that calculation after the show because I'm not that good at multitasking. Maybe our audience can help us with that. We talked about, how it affects our hair and our joints, and we talked about, what's really causing this degeneration, right? Our body's inability to put these proteins back together to make the collagen. I mean, aging's inevitable, right? But we'd like to slow the process down, doctor. So what are some ways that we can help decrease this degeneration? Now, you mentioned a little bit about taking collagen. What does that look like? And then anything else that we can do to kind of help decrease this degeneration?
So you open up a big can of worms saying anti-aging. So we were talking just purely on collagen. That's one piece of anti-aging, right? So that's one little piece. And then we have the antioxidants that we need to be taking. We need to eat a good quality diet that's highly nutritious to help decrease the aging process. We also need to make sure that we're maybe keeping our hormones in the right state, like having enough testosterone, enough estrogen or progesterone, because if we don't have those hormones, our body's going to start degenerating much more quickly. That includes our collagen, that includes our brains, our bones, our cardiovascular health. All that's involved with diet, hormones, collagen, and a lot of other things that we went in great detail on that in just a recent episode.
So let's say we're dialing in our diet, we're dialing in, we're making sure we're balanced out with our hormones and so forth. And so now we're wanting to kind of just add that extra boost by going in and getting some collagen.
Yeah. So
what type of collagen should we be getting? What does it look like? There's
a big debate. Do we get a liquid collagen or do we get a powdered collagen? I know recently a lot of people are talking about the liquid is best. There is some new research that is coming out that's saying that the collagen is the best in liquid form. I don't know if that's absolutely going to have a ton greater effect than the powdered form. Maybe time will tell. This is just new research. We do have research showing that there is benefit from the powdered form also. I think the most important thing is we just need to make sure we get a good quality collagen that has high amounts of type 1 collagen, which is the main collagen in our skin, and then it has some type 3 in there. If you're getting a collagen that doesn't have a lot of type 1 and type 3 in there, that's not going to be great for your skin. If it has a lot of type 5 in there, that might be great for your joints, but not necessarily going to be great for your skin. And also, you need a lot of type 5 for your gut lining. Let's say you have a good collagen that has a good amount of 1, 3, and 5. It's probably going to hit a lot of the big areas that we want healing with.
Now, what about 2 and 4? What are those for?
They're needed for other parts of our body. I mean, for our ears or other parts of our organs. I mean, those are usually going to be in collagen supplements, but the higher amounts I would like is the type 1 and 5. And if you're going for the skin, you got to get mostly type 1 and 3.
How do they make, what does it come from? Like what animal source do they use to make collagen?
Well, typically nowadays they're getting most of it from bovine. I'm sure they could get it from other sources, but a good quality grass-fed bovine source is a great one.
Okay, it comes from bovine, which I think is a cow. Is it going to taste? How do I take this? If I put it in my coffee, is it going to make my coffee taste like beef broth? Like how?
You can put it in your coffee. I don't know if I've really done it that way. I usually put it in a smoothie or something. If you put it in your coffee and you like it, great. Put it in whatever tastes good. Or you could put it straight up in your mouth. It usually doesn't have much flavor to it. It might make a little different consistency in the fluid that you have, but if you put it in a smoothie, you won't notice it at all.
All right, good to know. All right, so we looked at the numbers here. We got 1 is good for skin, and 5 is also good for the gut. And then which one was good for joints?
5 is great for the joints too. Mm-hmm.
So we looked at the collagen numbers for the skin and the joints. We've talked about diet, making sure that we're improving our diet with the amount of amino acids and so forth. And so this really addresses, I think, the part that you were talking about where we can add back in some of the collagen that we're not producing. You mentioned a little bit of some things that we can do to kind of help our own body kind of balance things out. But at what point what might we need more support? When we might need to go see a doctor like yourself to really address our skin or our joint issues when it comes to our aging?
So let's say you're at the point that you already have a lot of wrinkles and your skin's starting to sag quite a bit now. just eating more collagen or eating a healthy diet really isn't going to start tightening up the skin. Let's say you get to the point that your knee joints are going to start to degenerate, or your hip joints. Taking a collagen supplement or eating is not really going to regenerate that collagen. So we need to be more aggressive about it and give treatments that will stimulate regeneration of the cartilage inside your body. So what I like to use is platelet-rich plasma and also stem cells, which you can inject into the dermis of the skin, or you can inject into the joints of the body to stimulate regeneration and healing. So this will lead to tightening of the skin because it's going to regenerate that collagen again. So the skin sags because of degeneration of the collagen. So we inject the PRP in there, and that stimulates the regeneration of the collagen, and then the skin starts to tighten up again. And it brings back that youthful appearance again in the face. And this also happens inside our knee joint, for example. Let's say you have some degeneration in there, you have osteoarthritis. We can inject PRP or also stem cells into that joint space to stimulate regeneration and healing of that specific joint. So we're able to give you back your joint again and give that cushion back. So you don't absolutely have to get a knee replacement for that.
Wow. How long would a treatment plan like this look like? If I for someone that 40, 40 or 50 years old coming in for, let's talk about the skin part. Coming in, you give them these injections, this PRP. What does it stand for?
Platelet-rich plasma.
Is it my own plasma?
Yeah, it's your own. You're making platelets all the time from your bone marrow. So what we do is we draw your blood, and then we put it in these little vials. Then we put it in a specialized centrifuge that can separate your platelets well, spin it up in there. Then we extract out the platelet-rich portion of your serum, and then we put that in some syringes, and then we inject that right into the dermis of the skin, which then gives that high amount of platelets right in there that will stimulate regeneration and healing. Like I was saying, platelets have high amounts of growth factors, which will help with that regenerative process in there. And PRP has some stem cells in there too that will help with that. So stem cells are little immature cells that could be turned into any type of structure inside the body. So whatever it gets in contact with, let's say if we inject it right into the dermis, it's going to stimulate that collagen right there. Let's say we inject it into a joint, it's going to stimulate the collagen inside that joint.
That's fascinating. So how long after getting a treatment might someone see some results?
So typically we do about, let's say for the skin, we usually do about 4 treatments, and we space it out about 6 weeks, and then we get the results we want. And then we usually do a maintenance of doing a treatment every 12 months to 18 months to maintain the results. Once you get it done, we regenerate that skin, but then your skin's going to start degenerating again. And then we need to keep on regenerating that to maintain the results there.
Am I going to walk away with like scabs on my face? Like what are you going to look like? Can I go back to work the next day, or is everybody going to know I got this treatment done?
So yeah, you definitely could go back to work the next day. No one's going to really notice that. We use really baby needles, so you're not going to have any scabs there at all. We also put a little bit of epinephrine in there to keep the bleeding down, so you won't bleed a lot when we do the procedure. If we don't use epinephrine, you don't like it, you might get slight bruising in these areas, and that goes away in a couple of days. But if we use the epinephrine, really you don't notice that you had it done at all. You get immediate improvement if we do something called a platelet pore filler. So we could even make a filler out of your own platelets. So we do that in my office. We make the filler out of your PRP and we inject it, and we could fill in these deep gaps, like let's say around the nose, or deep gaps in the chin or around the eyes. We can take that away the day of, so you could leave and look completely different after we're done.
That's amazing. Wow. I had no idea that you can do that now. And I think that I'm so shocked by what you're saying. Comparing it to Botox, because that's kind of a common thing right now. A lot of women I know and men are getting this. How might what you're talking about compare in results? Would it be at the same plane of results, or a little bit milder, a little stronger?
So let's say we just do the PRP portion and we don't do the filler portion. You usually aren't going to notice something immediately, because what we're doing is regenerating the collagen. You're usually going to notice the full results of this 3 months after we do it. You will notice things after about 3 to 4 weeks, because the process will start, but the full regenerative process will be done in about 3 months. So Botox is going to deaden the skin and deaden that nerve and tighten it up immediately. So you're going to notice it very quickly. Then you can't move your face the same after getting the Botox. This way your face will be exactly the same as it was, except you're going to have tightening of that collagen in there. So it's not going to be immediate. But if we do a platelet pore filler, you're going to notice improvements that day, and you're going to look completely different when we do that.
That's
Because
great. I
that's
think
going
that
to put that filler in there and fill up those wrinkles.
and then you don't have to worry about having toxins put in your body or these other types of chemicals. So much more natural approach. I had no idea that there was this natural approach to facials. That's fascinating. Okay. So as far as the joints go, you've talked to me a little bit about, stem cells, ozone, and then you've already mentioned PRP. Can you tell us a little bit more about the role of ozone and other ways that we can help with the joints and then how you go about that with people who are really struggling in that area when it comes to aging?
So ozone could be used in several ways. I use ozone mostly in the orthopedic arena, but I do use it in the cosmetic area too. But you can inject ozone inside your joints, let's say your knee or let's say your neck or low back or shoulder, to stimulate regeneration and healing. Ozone is hyperactivated oxygen. So oxygen is O2, ozone's O3. So what happens with ozone is it's going to go into the joint and it's going to cause a local irritation there. And then it's going to bring in your immune system. It's going to bring in those platelets and your immune system to stimulate regeneration and healing in that area. And then it's also then going to get broken down into oxygen. And one reason why collagen or your joints don't heal very well, or your ligaments, is because it doesn't get good blood flow. It's not going to be able to heal and regenerate very well because it's not getting oxygen or nutrients in there. So when we do ozone, we're getting the benefits of bringing the immune system to regenerate it. Then it gets broken down to oxygen and supply what it needs to be able to heal and regenerate in that area. I do it for the skin, and I do it for helping degenerate some of the fat, like in cellulite or things like that. It can be really great for that because it helps break down the fat. Yeah.
Well, I'm just thinking about like timeline as well. So, similar question as with the skin treatments. Someone who's having joint issues and they come in and they have this ozone treatment, this, PRP and so forth. Are they going to get results right away, or is this also something that's going to take a few months for the regeneration to kick in?
So yeah, you can notice the improvements that day, because what happens great about ozone too is it decreases the inflammatory response. So it still allows healing, but it decreases the inflammatory response. So what it does is it decreases what's called leukotrienes, which I call bad inflammation. It doesn't do anything, it just causes pain. But it still allows what's called prostaglandins, which stimulate regeneration and healing. So that's what's really cool about ozone. It blocks leukotrienes, but still allows prostaglandins to go there to regenerate and heal. So you will get the regenerative aspect, but also you can feel better that day after getting the treatment.
That's awesome.
Yeah, so going into stem cells. So stem cells, they are immature cells that can be stimulated into any other cell. So when you inject it inside, let's say, a joint, that is going to then turn into that collagen. So those cells are then going to turn into collagen cells. And that's going to then start regeneration and healing of that specific area. And that's what's so cool about stem cells is you can put it into certain areas and then it will be made into that area and it will really regenerate the body. So if you put it in the face or the joints or anywhere in the body, it will stimulate that regenerative aspect.
Now, the stem cells is same thing. I know that you said the PRP comes from our own blood. Are you pulling the stem cells from our own blood too, or some other source?
I mean, you can get stem cells from your own body. You could get it from your fat, or you could also get it from your bone marrow. Those are good ways too. But my favorite way is actually get it from umbilical cord blood, or you could get it from other areas of the placenta. And this is from a live birth that mom gives consent and they track them and make sure everything's healthy and good with that placenta. And then they extract out the stem cells from there and then they freeze them. And then when we need them, we put them into the body. I like it like this is because those stem cells are little baby stem cells that are very young and are ready to stimulate regeneration and healing. If we get it from, like, let's say a 60-year-old guy, his stem cells aren't going to work as well as an infant's that is ready to go to stimulate regeneration, because when you're an infant, you have so many areas that need to be made. Your organs are still growing, etc.
That's fascinating. Dr. Jake, thank you so much for your time today. And if you want to schedule a virtual consult with Dr. Jake, then set an appointment for a virtual visit at integrativemedica.com. His team can send sampling kits so that you can get lab work done at a local lab. They'll send it over to his integrative doctors at Integrative Medica.
Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone you know has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. Integrative, MEDICA.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.